Hi guys, welcome to my channel. Today we are going to learn about the important landmarks and what happens behind these landmarks in the thorax. This is important and commonly questioned as first year students who are learning anatomy. So the important bony landmarks of the thorax are the right sternoclavicular joint, the left sternoclavicular joint, the right first costal cartilage, the right second costal cartilage, and the right third costal cartilage. So we will learn what happens behind each of these points. So now going into the veins, the right and left brachiocephalic trunks form behind the right sternoclavicular joint and the left sternoclavicular joint respectively. So that means the right internal jugular vein and the right subclavian vein combines to form the right brachiocephalic vein, and the left internal jugular vein and the left subclavian vein combines to form the left brachiocephalic vein. So that means the left and right brachiocephalic veins are formed posterior to the sternoclavicular joints. Okay. Then the right brachiocephalic vein descends almost vertically like this, and the left brachiocephalic vein descends by passing posterior to the superior portion of the manubrium sterni. The right and left brachiocephalic veins form the SVC behind the right first costal cartilage. Then the SVC or the superior vena cava enters the fibrous pericardium behind the right second costal cartilage, and the SVC drains into the right atrium at the right third costal cartilage. Okay, so what did we learn? The right and left brachiocephalic veins form behind the right and left sternoclavicular joints respectively by the union of the internal jugular and the subclavian veins. The right and left brachiocephalic veins form the SVC behind the right first costal cartilage, and the SVC enters the fibrous pericardium at the level of the right second costal cartilage, and the SVC enters the right atrium, drains into the right atrium at the level of the third costal cartilage on the right side. So this is what happens to the veins. Now let's see about the arteries. The right subclavian artery arises from the brachiocephalic trunk, this brachiocephalic trunk at the level of the right sternoclavicular joint. But the left doesn't arise there because it arises straight away from the arch of the aorta, just lateral to the left common carotid artery. But it also passes behind this left sternoclavicular joint. That's about the arteries. And another thing that happens at the behind the right sternoclavicular joint is that the right lymphatic duct joins the right brachiocephalic vein, and behind the second costal cartilage on the right side, the azygous vein shown here, joins the SVC just before it pierces the fibrous pericardium. And on the left side, we can see here the thoracic duct, and it goes up like this, and it joins the left brachiocephalic vein behind the left sternoclavicular joint. So this diagram summarizes all of that. So what did we learn up to now? The right brachiocephalic vein and the left brachiocephalic vein forms behind the right and left sternoclavicular joints respectively, and the SVC forms by combining both of them behind the right first costal cartilage, and the SVC pierces the fibrous pericardium behind the right second costal cartilage, and it drains into the right atrium behind the right third costal cartilage. Then the left thoracic duct joins the brachiocephalic vein behind the left sternoclavicular joint, and the right lymphatic duct joins the right brachiocephalic vein behind the right sternoclavicular joint. And then the right subclavian artery arises from the brachiocephalic trunk behind the right sternoclavicular joint. So, and the azygous vein enters the SVC just before it pierces the pericardium at the right second costal cartilage. So, what happens behind the right sternoclavicular joint? The anterior is the right brachiocephalic vein, and posterior to that is the formation of the right subclavian artery. Thank you very much. Please like, subscribe and share with your friends.